Hello, my name is Kelly Tebow, and I'm with the New Jersey Center for Tourette Syndrome and Associated Disorders, and I will be your organizer for this evening. I would like to welcome you to our session on neurodevelopmental conditions and anxiety, common causes, and effective solutions. Thank you all for joining us. Before I have my colleague introduce our speaker for tonight, I'm going to cover some housekeeping items with you. All participants are muted. If you have a question, please type it in the bottom of your question box and click send. We will get through as many questions as time allows, and should your question not get asked, please feel free to post it on the blog tomorrow. In addition, tonight's presenter is available to take your questions on the Wednesday webinar blog, which is accessed from our homepage under the heading Programs. This blog will be monitored for the next 7 days. Feel free to look and post questions as often as you like. Answers will be archived for future reference. If you missed part of the presentation or would like to watch it again, an archived version will be posted to our website. We value your input, and in order to expand our webinar experience in the future, we need everyone to fill out the survey as you exit the webinar. The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Barbara Chabner, the program manager of NJCTS. Barbara?
Thank you, Kelly, and good evening, everyone. Thank you for joining us on our webinar this evening. Tonight's presenter is Dr. Christopher Lynch. Dr. Lynch is the program coordinator for the Pediatric Behavioral Medicine Department of Goryeb Children's Hospital and Atlantic Health System Children's Health. Through this department, Dr. Lynch oversees programs designed to build resiliency, enhance health outcomes, and improve the quality of life for children with chronic illness and chronic pain conditions. Dr. Lynch also has an interest in anxiety management for children on the autism spectrum. He has written 2 books on this topic, including the award-winning Totally Chill, My Complete Guide to Staying Cool, and Anxiety Management for Kids on the Autism Spectrum, Your Guide to Preventing Meltdowns and Unlocking Potential. Dr. Lynch promotes behavioral health in the community by providing talks and seminars to a wide range of audiences and also pens a blog for Psychology Today. We are lucky to have him with us tonight. And without further ado, Dr. Lynch, take it away.
Thank you very much. You can see my screen? Okay, great. Okay, so thank you for the kind introduction. So as you heard, I'm a child psychologist, and I work out of Goryeb Children's Hospital, which is in Morristown, New Jersey. And I have a special interest in working with kids with neurodevelopmental concerns, and in particular, anxiety management, because I find that kids with neurodevelopmental concerns, anxiety is prevalent and often contributes to behavioral challenges. Speaking of anxiety, I certainly want to acknowledge the stress and anxiety that we are all experiencing as a result of the pandemic, and certainly I want to touch on this. But first, I want to step back and talk specifically about kids with neurodevelopmental conditions so that we have an idea of how to approach this particular group of people so that we can support them both through the pandemic and beyond as well. Okay, so first, before we go into anxiety, I'd like to talk just a little bit about the whole concept of diagnostic overshadowing, because it wasn't that long ago that mental health concerns and developmental issues were not thought of as being able to occur together. And this was partly due to diagnostic overshadowing. Diagnostic overshadowing means that if somebody had a neurodevelopmental issue, that's all that we saw. And we didn't look beyond that to consider that they may have co-occurring conditions. So for example, if someone with an intellectual disability had psychotic symptoms, we would dismiss that as being part of their intellectual disability. Someone with autism who also had an anxiety disorder, we would say, oh, that's part of their autism. And someone with Tourette syndrome that had OCD, we would say, well, the OCD is really part of the Tourette's. We didn't look beyond the neurodevelopmental condition to see that there could also be co-occurring mental health concerns. And this was a real disservice because over time with research and with clinical experience, what was found was that not only do people with developmental conditions have mental health concerns, they have them at rates that are actually higher than the population at large. So it's a real important issue to address. And as I said earlier, anxiety seems to be particularly prevalent amongst this group. So I just want to talk just a little bit about what anxiety is, because anxiety is something we all experience. Anxiety and yet anxiety is something that's hard to describe in words. So we talk about the symptoms of anxiety. And some of these symptoms we can observe. So for example, we can see someone being tense. We can see somebody breathing rapidly or sweating. Some of these we can ask about or people can tell us about. So for example, if somebody is worrying about something or they have a particular fear that they can tell us about. But a lot of these we need to infer, particularly with children, because if a child can't express him or herself with words adequately, we have to infer what's causing their distress. And so some of the behavioral symptoms of anxiety that we have to infer from include avoidance, an exacerbation of tics or compulsive types of behaviors, and behavioral challenges in general. So I have some research. I'm not going to go too much into detail regarding the research, but I just want to give you flavor for how prevalent anxiety is across a wide range of developmental concerns. So, for example, we see anxiety and intellectual disability. This study here took a look at children with intellectual disability, and they found that close to 40% met the criteria for at least one mental health disorder, the highest being disruptive behavior disorders and anxiety disorders. We know that anxiety is quite prevalent in autism. This study here did a meta-analysis where they looked at a number of different studies, and they reviewed that research, and they found that close to 40% of children and adolescents on the autism spectrum met the criteria for at least one anxiety disorder. And then we have anxiety and ADHD as well. So this was a literature review that looked at anxiety and ADHD across the lifespan, and they found a 25% comorbidity rate. And they noted how anxiety impacted and exacerbated symptoms of ADHD. So it made work and memory deficits even worse, and it impacted sleep even worse when somebody had the combination of anxiety and ADHD. And then finally, we certainly see anxiety in Tourette syndrome. And this study looked at 126 children with Tourette syndrome, and they found a 21% comorbidity with generalized anxiety disorder. And the recommendation that came out of this study was that any child that's diagnosed with Tourette syndrome should also be screened for both anxiety and depression because of mental health concerns that we see in Tourette syndrome. Okay, so what's my story? Do you recognize the country? That's right. Some of you, I'm sure, got it right. That's Ireland. So for a period of time, I had worked in Ireland. I worked there for a period of 5 years, and my commute was to the left of those mountains there, the Camara Mountains. And while I was in Ireland, one of my stints was doing a group for teens on the autism spectrum. So what do you do when you have a group of kids on the spectrum? You do social skills. So it was billed as a social skills group, and it was going okay, but the interactions were a bit stilted. It just felt a bit tense. So what I decided to do was I decided to start off each meeting with a relaxation strategy, as much for me as for them. So for example, one session I may do a deep breathing exercise. Another session I may teach a meditation exercise, and so on. And I discovered a couple of things. First, I discovered that the group members were well able to learn the techniques, and they really saw the value in it. They really liked the techniques, and they found them very useful. But secondly, what I discovered was that once they were relaxed, their social skills improved. Imagine that. The idea that the more relaxed we are, the better we are able to socialize. I know that sounds kind of silly now, but again, that goes back to that whole idea of diagnostic overshadowing, that that people with neurodevelopmental concerns, things like anxiety affect them the same way that it affects us. And so we need to address that for kids with neurodevelopmental concerns, just like we do for anybody else. So it was at that point when I really started to shift the focus of my work from being skills-based, primarily teaching social skills, to being therapy-based, primarily teaching coping skills, and in particular anxiety management. Because you can teach a kid all the skills in the world, but if they have anxiety, they're not going to pull it off. And you can have all the behavior plans in the world, but if anxiety is driving that behavior, until you address the anxiety, you're not going to change that behavior. Okay, so why do we find anxiety across so many neurodevelopmental conditions? Well, there's a couple physiological explanations, or I should say contributing factors. So we have neuroanatomical brain differences. So there's a structure in the brain called the amygdala, and this is highly implicated in the processing of emotions, and in particular has very strong associations with fear and anxiety. And this tends to grow differently across a range of neurodevelopmental conditions, including autism, ADHD, and Tourette syndrome. There are also neurochemical differences. Neurotransmitters such as serotonin and dopamine are highly implicated in processing of emotion. And then again, we find those differences in the regulation of these neurotransmitters across neurodevelopmental conditions. So there's very interesting research that's being done in terms of the physiological aspects of what's going on here, but that's not my focus. For one thing, I'm not going to, as a psychologist, I'm not going to be able to intervene at a physiological level. Secondly, we have the whole chicken egg problem. Is the biological differences causing anxiety, or is anxiety causing the biological differences? So what I'm more interested in is I'm more interested in focusing on what I can change through either therapy or through recommending changes in the environment. So I'm going to look at tonight, I'm going to go over common neuropsychological characteristics that may be contributing to anxiety. In addition, I think it's very important to address stigma, stress, and strain, because our kids, regardless of what condition they have, very often they do encounter prejudice and stigma, and that creates a lot of stress and strain, which again will contribute to anxiety. Okay, so the first thing I'm going to cover are cognitive factors. Whether you have an intellectual disability, autism, ADHD, or Tourette syndrome, there are some differences in the way that information is processed. And one of these differences is that kids that I work with across a wide range of neurodevelopmental concerns tend to process information in the detail-oriented manner. They tend to be focused on details, and they tend to have difficulty with understanding context. So, for example, take the example of my office. So my office here, I don't know if you can see any bit of it, but there's a painting behind me of a beach scene. There's a couple of chairs to the right of me, and I have a little bird statuette, okay? Now, if a kid doesn't have a neurodevelopmental condition and this little statuette is missing, they may notice it, they may not, but it's not gonna be a big deal. They may say, oh, what happened to the little bird? But if I have a kid coming in, let's say, for example, with autism, and they notice that this is missing, well, first of all, they're going to notice this immediately. And then secondly, they're going to be a little bit distressed by it, because when you process the world by details, if a detail changes, your entire world has changed, and it can really throw our kids off. So for that reason, a lot of our kids get very anxious when things change, particularly if it's unexpected change, okay? The transitions are related to this, so that a transition is when you move from one task or situation to another. And again, if you process the world by details, when you're moving from one task or situation to another, you have to adjust to a whole new set of details, and it can take some time to do that. So when we rush our kids from one task or situation to another, or even if we're taking our time, to our kids, it may seem like we're rushing them. They get distressed because they're confused, and that distress feeling and confusion can quickly lead to anxiety. So, for example, getting ready in the morning, moving from task to task within a school day. I find that even here when I'm doing therapy with kids, I find that they get kind of dysregulated as they start the session, and then when they end the session, because again, that's a transition, and they have to get used to that. Okay. Inflexibility is another characteristic that can contribute to anxiety. The brain likes order. And when kids have a neurodevelopmental condition, no matter what it is, they try to make up for that disorder by imposing a lot of rules on themselves and on the world. So they may develop they may be very keen to point out when kids break rules. They may point that out to the teacher or to other kids. They may correct teachers. As they get older, it may get them into trouble because they may correct law enforcement people, or they may correct their bosses. Kids I work with are, they're very intelligent. And so if I say anything that's even mildly inaccurate, they're going to point it out to me, because they have that certain rigidity about things. So if they're talking about a Marvel superhero, and I mention a superhero that's from DC Comics, man, I'm going to hear about it. It's like, no, Dr. Lynch, you got it all wrong. That is not a Marvel character. So that creates that strain and anxiety that unfortunately doesn't do them favors socially. There's related to that are fixed routines, where a lot of the kids I work with, they like things to happen in a certain order or in a certain way. And if you deviate from that, it can create anxiety. I think one of the clearest examples are the routes that you take to places. So if you have a route that you take to school or to the shopping center, if there's a tree down and you have to go a different route, that can really cause a lot of stress for kids with neurodevelopmental issues. Again, it comes way back to the way that they're processing information. And it's not that they want to be anxious or they want to be difficult, but when things don't go the way that the brain expects it, it really throws our kids off. Okay, so what can we do about this? Well, first of all, you want to, whenever possible, minimize abrupt or multiple changes. You don't want to run your home or your class like a boot camp, but you want to make sure that if you do have changes going on, that you make sure that there's one or two at a time, and that you prepare your student or your child as much as possible for that. You want to ease people into transitions. So providing reminders and providing visual supports can really help someone to understand what's going to happen next, and that can really ease that anxiety. One caveat here, you want to be careful with the notion of time. Time is an abstract concept that a lot of our kids struggle with. And one of the clearest examples is video games. So if you tell your kid, 10 minutes, you have to get off that video game, it could be 9 minutes and 50 seconds, and they can just about be ready to reach a new level or achieve some kind of new achievement in the game. And forget it, you're not going to get them off at that time. Or if you do, there's going to be a significant amount of distress and maybe even behavioral challenge. So what I recommend is, if you try to avoid using time if you can. You can't always, but talk about the sequence of events. And when it comes to video games, if you talk with your child about how long does this game take, or how long will it take to you to get to the next save point, they may say 10 minutes. You say, okay, so I tell you what, as soon as this game's over, then turn it off, and then we're going to get ready to go. Okay. Now you may still need to be kind of hovering around, and you may still need to remind your child, but that's going to help to ease them into that transition so much better than if you just use an arbitrary time. You want to prevent routines from forming in the first place. So for example, I had consulted at one time with a preschool, and they had tricycles out in the yard where they have their free time, and they were different colors. If a preschooler went out and they chose, let's say, the red tricycle on one day, the next day we would steer them towards, let's say, the green tricycle. Because what would happen is, if they chose the red tricycle on day one, and then on day two, and then on day three, that's it. That could be enough to form a very rigid pattern, so that if another child wanted that red tricycle on day 4, it can really cause problems. So you want structure, but you want to mix it up within that overall structure. And certainly you want to provide praise for when change or transition are handled well, and point out to your child or student how that really helped him or her. Okay, sensory sensitivities. Sensory sensitivities occur across a range of neurodevelopmental concerns. I think it's most blatantly obvious in autism, but you see it in other conditions as well. And sensory regulation difficulties can be hyposensitive, where you don't get enough input from the environment, or in the case of anxiety, what's more likely is hypersensitivity, where a sensory input doesn't get properly filtered, so it comes crashing through, and it's experienced as being very harsh and even painful. Okay, this sensory sensitivities can happen with the 5 traditional senses, and it could be general or specific. So regarding noise, for example, a child may be sensitive to noise in general, or it may be very particular noises that really cause distress. With touch, things like being in crowds can be challenging, or it can be the feel of things on your body. So a lot of my kids, for example, they don't like the feeling of tags on their shirts or the feeling of seams on their socks, and this can cause distress. With sight, for example, a lot of my kids are sensitive to light, and they particularly don't like fluorescent lighting. With smell, again, it could be general or specific. And with taste, you can have taste aversions that can contribute to restricted eating patterns. Now, it's important to note that there are other senses besides the 5 traditional, and autistic persons who are able to articulate about their condition have really pointed this out. So you have vestibular senses, the sense of balance. You also have things like pain and temperature, and even barometric pressure that people with sensory sensitivities note having, and they note that it causes distress. And in general, people with developmental challenges have an overall narrow sensory comfort zone. We all have this comfort zone that we operate in, but with kids who have developmental concerns, it's very narrow. So they're very easily overstimulated or very easily understimulated. If they're understimulated, then their brain starts to look for a little bit of action, and that's where they might get kind of a little bit wiggly, and they might kind of get a little bit pokey and might start to kind of cause problems, not because they want to, but because their brain's looking for stimulation. And if they're overstimulated, then they're going to get anxious and they may withdraw or again have behavioral challenges. Okay, so what are some strategies for sensory sensitivities? Well, first of all, if it's something you can easily avoid or minimize without it affecting the child's life, then do so. So, for example, if we'll say if a kid is sitting in class and they're distracted by kids in the hallway, well, you can move their seat or or if they're have challenges with crowds in the hallway, we'll say post-pandemic, they can leave the class early, or they can wear tinted glasses for lights or headphones or earbuds to deal with sounds, okay? There's also broader environmental strategies, such as using sound absorbing tiles or the use of natural lighting. All these things can just help increase comfort level for our kids. And you want to come up with a coping plan for dealing with sensory challenges. So for example, we'll say post-pandemic, if you're going on vacation, you can think about what restaurants you may go to or where you may go where it may be crowded, and have a plan so that if your child gets overstimulated, you know what you can do. When I'm working with kids, again, post-pandemic or pre-pandemic, if they're going to an event like a wedding, many reception halls have full floor plans on the internet. We'll look those up and we'll see, okay, there's a balcony over there, there's a little nook over there. And so if you get overstimulated, here's some places you can go to. And of course, I would do that in consultation with the parents so that everybody's on board with the plan and we know that it's safe. And in general, you want to be aware of and aim to keep a child in his or her comfort zone. And if you see them being understimulated, when they start to get kind of pokey, try to get them engaged in something. And if they seem overstimulated, try to give them some respite from that. Okay. There are also social challenges. And again, kids with a wide range of developmental concerns can struggle socially. And there's a number of reasons for this. For one, there's language demands, and social situations call for a lot of language, and a lot of it's kind of metaphorical. And so a lot of our kids struggle with that kind of language. For example, I was working with a teen and he was invited to hang out with 5 of his peers, and I was absolutely delighted for him. But then he looks at me and says, Dr. Lynch, I can't do that. How can I meet with 5 kids? How can I have 5 conversations at once? I don't have 5 mouths. So it wasn't that he was shy, it was that the language demands were just overwhelming for him. Just the idea of it was overwhelming for him. Again, as I mentioned earlier, there are sensory factors that happen in social situations. When you think about social situations, pre and post pandemic, they tend to happen in loud, crowded places where there may be a lot of smells and other things going on. But there's also social skills development. A lot of our kids lag in their social skills, okay? And again, I find this across developmental issues. And so when they're younger, they may struggle with things like eye contact and turn taking, starting conversations, ending conversations. And so this can create some anxiety in social situations. As they get a bit older, they may master some of the mechanics of social situations, but then social situations start to become more complex and nuanced and they can't keep up. And it's stressful to be in a situation where you know you're not quite getting it, but you're not sure why. And so again, that contributes to social anxiety. And then there's the whole idea of stigma. And so if a kid does have behaviors such as tics or self-stimulatory behaviors, this might create some self-consciousness and again contribute to anxiety in social situations. Okay, so what can we do about these social challenges? Well, first of all, you want to set up social situations that are more likely to foster success and not failure. In general, the kids that I work with tend to do better in situations that are small, structured, and strength-based. So 1 or 2 other kids to start with, maybe 3, have it have a task that they're doing, such as playing a particular game or going to like a movie or something like that, and base it around their strength so that it's something that they feel good in. Sometimes what I find parents do is they throw their kids into activities because they think it'll be good for them socially. But for example, they may throw them into a team sport thinking it's going to help them, but it doesn't because it's a situation that's very large, it's very unstructured, there's a lot of language going on. And so unfortunately, they fail at that and it doesn't do them any favors socially. And then the next time, they're even less likely to have a good experience. Not again, this doesn't apply to all kids. And again, this is something that you start with and then you can build from there. Okay. And you can work on social skills. And if you do, though, you really want to focus on generalization. So there have been times when I may have talked to a kid about starting a conversation, and I'll ask him about it a week later, and it's like, "Oh, you wanted me to do that at school? I didn't realize that." So you have to be very specific and close to the time when you want to see a social skill, and then you need to prompt it, cue it, and reinforce it. Okay. So for example, have somebody right before lunchtime, again, we'll say post-pandemic, say, hey, I know you like Star Wars. You know what? Charlie likes Star Wars too. Why don't you ask him about the new movie that just came out? And then check on it right afterwards. Hey, did you ask about it? Oh yeah, great. So now you know that Charlie also likes Star Wars. You guys can talk about that again. So the more concrete, the more specific, the nearer you are in time, the more likely you are to get a skill across to your child or student. And in general, we want to foster a tolerant atmosphere. Our kids have so much to offer other kids, and so much of their behavior is non-intentional. And we need to help the other kids to understand that our kids are not dangerous, they're not weird, they may have some quirks, but that's also could be a real source of strength for them. And we need to build up that tolerance, because nobody's comfortable in a situation where you feel like you don't belong. So the more we can bring on that atmosphere, the better off our kids will be. Okay, language demands. So a lot of our kids struggle in aspects of language. Expressive language is the ability to convey information through language. Receptive is the ability to take in and understand. Okay, so having difficulty with expressing yourself can really create a lot of anxiety. And if you do get anxious or frustrated, it makes it difficult for you to express that to others and then to get help. So that can only ramp up your anxiety. And if you don't understand somebody, you don't understand the direction that somebody's giving you, again, that's going to create anxiety. But even kids who can communicate their basic wants and needs, they struggle with more abstract aspects of language, such as pragmatic language, which is the ability to apply language in a social context, and also with non-literal forms of language, such as metaphors, similes, and sarcasm. And trying to keep up with that socially nuanced language can really lead to anxiety and confusion for our kids. Okay, so what can we do about this? I'm a really big believer in visual supports. And yes, I know you can have kids that read words, but a little bit of support goes a long way. When you think about when we go to places like airports and it's color coded, that helps so much because we then don't have to read each airline on a particular sign or a parking lot that is color coded. So little bit of visual support goes a long way. So using a visual schedule to help kids to understand what to come next, using pictures to remind somebody of expectations and what you expect of them behaviorally. If they're moving to a new school, using photographs or video of the new school to get them ready for it. All of these things can really help to ease anxiety. You want to use clear communication, using what's called reduced language when necessary. So you want to focus on a few key concepts and not be long-winded when we're trying to convey something to our kids. The example I often give is that if you're trying to get ready and you're trying to get your kid ready, what you don't want to do is you don't want to do this. Come on, get ready now. Get your socks and shoes on because we're going to Auntie Mary's house. And don't forget what happened last time. We were late and we missed the cake and everybody was really, really upset. All that may be true, but that's just too much language for the kid. It's going too fast to process. So you want to break it down and say, okay, we're going to Auntie Mary's, get that idea through. Then we need to get ready. You need to get your socks and shoes on, okay? Now, don't get me wrong, I don't want you talking like a robot to your kids all the time, but certainly during those times when you really need to get a message across, you need to use that kind of language, okay? And you want to give a means for expressing frustration or anxiety, particularly kids that may be minimally verbal. And it could be a single word or a short phrase. It could be a picture that they show you. If they use an augmentative device, make sure that they have a way to tell you when they're anxious or need help. Okay, task frustration. So a lot of our kids struggle and first of all, our kids have wonderful strengths and they have excellent memories, they're very creative, and there's some things that they absolutely thrive at. But very often there are pockets of challenges for our kids. One area are motor skills, particularly fine motor skills. I find that a lot of our kids struggle with finer motor skills. Okay. There's also executive function skills. Executive function is kind of like the manager part of the brain. An example that I give is that you can have a restaurant in a great location with a great wait staff and a great chef, but if the manager's lousy, it's not going to pull it all together. And that's what happens to a lot of our kids. They have wonderful strengths and wonderful skills, but it's pulling it all together that they struggle in. And it's organizing information and it's planning it. That's where they struggle. Abstract thinking skills too, especially abstract social emotional concepts a lot of our kids struggle with. So for example, when language arts starts to get to poetry or when writing gets to opinion pieces, a lot of our kids get very anxious around that. And there are a couple of key academic areas that a lot of my kids tend to struggle with. Reading comprehension is one of them, where they can read fluently, but may have difficulty with understanding what they're reading. But one area that a lot of our kids struggle with is in writing, because writing really relies on all of those aspects that I just went over. There's a motor component, there's a planning and organization component, and it's an abstract concept because you're trying to you have to convey to the reader what's in your mind, and that's an abstract task. All right, so what can we do about task frustration? First of all, you want to make sure that your child or student has a way to express when they are frustrated. Um, so again, could be a word, a phrase, a picture, what have you. And then the phrase I like to use is remediate, accommodate, or celebrate. Remediate means to build up relative weaknesses through targeted intervention. Accommodate means that you use supports to work around a particular challenge or work around a weakness. And then celebrate is that you design tasks in a way that's really going to draw out the child's strengths. So take writing, for example. So using occupational therapy techniques to improve writing, to improve the fine motor aspect is an example of remediation. Giving a child a laptop or speech-to-text capability is a way that you're accommodating for that. And having the child write a story about, let's say, Star Wars or Minecraft or whatever the new thing is, Among Us, is a way that you can, again, get them motivated and interested and really have them use your strength, even if it's an area that they're not strong in typically. You also want to consider the timing of tasks. So you want to give challenging tasks when the kid is most alert. Some kids, this is the beginning of the day. Some kids, maybe it's after a particular rest period. And for some kids, you want to alternate tasks between challenging and easy tasks. Okay, you just want to get that sweet spot. We all need that sweet spot where we're challenged, but we're not overwhelmed, and we have to consider that. And that's why you want to present challenging tasks on a graduated basis. Make sure you're kind of hitting that sweet spot. The problem with our kids, or the challenge of our kids, is that can vary from day to day. So there may be one day where they're able to take on quite a lot of challenge, and another day when they're not able to. Maybe they didn't sleep as well, maybe they're going through medication adjustment, what have you. So we need to be sensitive to where our child is at on any particular day. All right, and I want to mention here briefly Tourette syndrome and anxiety and OCD, because more than a third of persons with Tourette syndrome also have OCD, and anxiety is and its reduction of anxiety is a common component of OCD. So I thought I'd mention it here. Okay. All right, so I'm going to shift gears now, and we're going to talk now, because everything I just talked about are things that we can do to manage the environment and to set up things for our kids. But what I want to talk about now is giving our kids coping skills so that they can manage their own anxiety. And why is this important? Well, first of all, we can't eliminate anxiety. Anxiety is part of life, and no matter what we do, our kids are going to experience it. Secondly, there won't always be a supportive person nearby. You may be fantastic at spotting your child's distress, but not everybody's going to do that. And you may not always be there, or a teacher or an aide may not always be there to spot that. And then most importantly, it helps to develop confidence and problem-solving skills and independence. It's important for us to have a sense of control over our environment and to know that when we get distressed, there are things that we can do about it. We don't have to just rely on others. So I teach a range of relaxation skills. And the important thing is that every kid I work with, whether or not they have a developmental condition, can learn these. Yes, I need to modify it in certain ways, but there are ways that we can teach this. So there are deep breathing strategies. In particular, I like to teach a diaphragmatic breath where you breathe in a way that you expand your lungs by lowering the diaphragm muscle. There's something called progressive muscle relaxation, where you tense different muscle groups and then you relax them, and you learn to relax them automatically over time. The use of imagery is picturing something that makes you feel relaxed. So I might go over a scene with the kids that I work with, such as a waterfall or a beach, and then I might have them make up their own scene just to get some buy-in. And then meditation, whether we're talking about classic meditation by repeating a mantra, a word, or a phrase, or mindfulness meditation, which is generally just kind of accepting whatever kind of comes into your awareness and going with that. So there are activities that combine both these body techniques and these mind techniques, such as yoga and Tai Chi, and they can be fantastic. And there are plenty of classes out there specifically for children, and there's also classes specifically for kids with developmental needs. So I encourage you to at least explore that possibility. I don't want to leave out kids with higher support needs. So kids that might have more intellectual challenge or that might be minimally verbal. So you want to make sure that they have a means to express their anxiety. Again, I mentioned this earlier, whether they have a touch talk or a pointing to something. You want to find things that are comforting. It could be music, it could be a peaceful place, and try to have them engaged in that so that if they can turn on the music or tell you what they like or indicate to you what kind of music they want to hear, that's going to give them that little bit of sense of control. Comfort objects can be great for getting through challenging situations, particularly things like medical visits. That could be a stuffed animal or a favorite toy. And you want to have active strategy. So giving somebody something that they can do, such as a stress ball. I have a rubber snake that I have here. A lot of the kids like it. And I call him Oscar. And I have one of the kids I work with is minimally verbal. And sometimes he'll hit his head and I'll just look at him and I'll say, Oscar. And he'll nod his head and I give him that rubber snake to play with. And it really, really helps him. And it's also important to have care for the givers, care for the caregivers. Um, when you're caring for a kid with developmental needs, that can really be taxing. It can really take a lot out of you, and it can be draining, and it can be difficult to kind of step outside the situation and manage your child's stress when your resources are tapped. So I'm a real big advocate of organizations such as this that can provide you with support. I'm a real big advocate of giving parents respite and giving them resources so that they can cope, because once they can cope, then they can better help their child. Okay. All right. And certainly if anxiety gets to the point where it's causing significant challenge and distress, you want to recommend therapy such as cognitive behavior therapy has a really good track record. They do relaxation, exposures, getting used to things that you get anxious about. Cognitive reframing is looking at situations from a different standpoint. If there's school-based anxiety, you want to coordinate with the school, and certainly you want to make sure that you're coordinating with all the medical professionals. Kids with developmental needs often have a number of different professionals, and sometimes different professionals are prescribing different things. Please make sure they're communicating, because some of these things can contribute to anxiety. Okay, just want to talk a little bit about, as promised, about the challenges of the COVID-19 pandemic. So, sorry, just looking at the time here. Okay, great. So we have a number of challenges. We have anxiety and fear over the virus, and this has changed over time. So at first it was, what is this virus? What does it do? Kids were very nervous about that. Now we have a better understanding of it, but now we're asking our kids to engage in what we call relative risk. This is the idea that we're telling our kids that situations that were dangerous are now safe. And this is happening on a week-to-week basis and even a day-to-day basis. And that's difficult for a kid, because kids like to know, they like to think in absolute terms. Either a situation is completely dangerous or completely safe. Not that school was safe on Tuesday, but it's not safe today, but it'll be safe again next week. So that is causing a lot of anxiety for our kids and for us. Adjusting to new and changing routines. Kids need stability and they need routines to thrive. We certainly know this with kids with developmental issues, and we've been asked to constantly adjust, and this is creating stress. Maintaining our academic progress and motivation. Kids are doing well in terms of this, but even the most highly motivated kid is really starting to tire of virtual learning, and it's kind of as if they're going through the motions and they're not fully engaged with the learning. And our kids with developmental issues, they really are suffering from a lack of individualized support. If there's anything this pandemic is teaching us, it's how important that one-to-one support is. And it's not so much for the content of learning, it's that mental anchor that one-to-one support provides. There are practical challenges associated with virtual, excuse me, I skipped one. There's the challenges of coping with the confines of quarantine. I don't care how big your house is, it probably seems pretty small right now. I know during the height of pandemic, when I was at home, um, um, no matter where I wanted to be, I had a family member there. There was a family member there. And if there wasn't a human family member, my dog was where I wanted to be. And I know that sounds kind of trivial, but that little stress builds up over time. And there's also very practical challenges of virtual learning. So some of our kids are struggling with the technology aspect. They may have weak internet connections. And this can certainly create a lot of stress. I saw a clip of a teenage girl was talking about a situation where her mom had gotten out of the shower and they have to keep the camera on during their virtual schooling. And the mom walked in front of the camera with just a towel on, and it was mortifying for this teenage girl, as you can imagine. So, and some kids don't want to show their room. So there's a lot of these practical challenges. And there's less socializing and extracurricular activity. And socializing and extracurricular activity are really buffers to stress, and we're really missing that. Yes, we're doing it, but it's still not quite the same. So how do we cope? Well, first of all, you want to answer your children's questions about the pandemic. There's nothing scarier than what a kid can imagine in his or own mind. So make sure if they have questions, make sure that you answer those questions honestly, but provide the information at a level that the child can process, and make sure to define any terms that might be confusing for them. You want to maintain structure with regular sleep-wake cycles, routines, and environmental cues. Try to have the virtual days and in-person days be as normal as possible. I'm encouraging my kids to wake up the same time no matter what, and to get dressed no matter what, as if it's a school day. You can make sure that in your house you have zones, if you can do this, designated for school and work, and other ones designated for relaxation. Also, of course, you want to balance that with variety. You want to watch for signs of stress. And remember, with kids, they may not tell you when they're stressed, but you may see it through other signs such as irritability, changes in sleep and appetite, and behavioral changes. And you certainly want to get, again, emphasize, get that individualized support however you can get it. Fight for it, advocate for it. It's so important. And use virtual mental health care. Mental health professionals were very quick to adopt to virtual platforms, so please take advantage of that. Okay, so these are my resources. I have a couple of books. One is Totally Chill, My Complete Guide to Staying Cool. That's a workbook for kids with a wide range of neurodevelopmental concerns. So I talk about how to manage stress, but in light of their concerns. I talk about sensory sensitivities and feeling left out, those sorts of things. Anxiety management for kids on the autism spectrum is geared for parents, teachers, and therapists. That's autism specific, but again, it can apply broadly as well. I also have a website, morethanbehavior.com. I do a blog for Psychology Today. And on social media, you can find me on Facebook at More Than Behavior. Okay, so with that, the key takeaways: mental health needs are common across neurodevelopmental conditions. There are things we can do to the environment to help, but your kids can also learn coping strategies. With that, I'd like to thank you for your time and then open it up for questions and answers.
Great. Thank you, Dr. Lynch. Thank you very much for that very clear and informative presentation with lots of great tips and takeaways. We have just a few questions, so I'm going to start with this one. Is there any evidence that magnesium and vitamin B6 helps reduce motor tics
Yeah, that's a
and
little
or anxiety in children? Sorry.
Okay. That's okay. No, that's fine. That goes that goes beyond my training as a clinical psychologist. And certainly, you know, if you want to work with a nutritionist, would be great in consultation with your pediatrician. There's a lot of research that shows there's multiple connections between the mind and the body, and the GI tract has a lot of those connections. In fact, the GI tract is referred to as the second brain, partly for that reason. So in terms of what I recommend, I'm a big believer in good nutrition in general, because if we have good nutrition in general, we're healthy, and the healthier we are in general, the better we are to buffer stress. I can't speak to specific supplements, that's beyond my training, but I certainly would encourage you to talk both with the nutritionist as well in consultation with either a pediatrician or a general practitioner for an older person.
Okay, great. Thank you. Someone notes that their child suffers from the cycle of anxiety, procrastination, avoidance, anxiety. Do you have any tips or strategies on how to help them break this cycle?
Yeah. Anxiety is one of the major, if not the major cause of procrastination. Now, our kids, they have a double whammy because number one, they have the anxiety that contributes to the procrastination. But number two, they have challenges with that executive function that I mentioned earlier. So they have challenges with understanding how long an assignment takes. They have challenges with planning how to do assignments and how to break those assignments down. So certainly you want to help with the anxiety as through all those things that I mentioned, but you also want to help your child to help them with the organization and the planning and having, again, the visual supports, having a calendar out and having intermediary deadlines can really help to alleviate that anxiety around procrastination. But it's an excellent question because it's a very common pattern. So please make sure you're working both on the anxiety piece, but also the organization side of things.
Okay, thank you. Um, and do you have any suggestions as to how parents can work with teachers in terms of trying to incorporate some of the suggestions and strategies that you mentioned?
Yeah, it's the more you share with teachers, the better. And again, when I say teachers, I'm talking to broad, I mean educational staff in general, because there may be an aide, there may be a resource teacher. Sometimes, if your child has medical needs, sometimes anxiety shows up in the nurse's office. So you want to make sure that the school the school in general understands what your child's needs are, and you want to make sure that they understand how anxiety may be impacting on him or her. So you can do that through conversations, certainly during parent teacher conferences. But if you're getting feedback on your child's behavior, let's say, make sure that your teacher understands that certainly you're going to address it, but make sure they understand that the behavior is not intentional, but that anxiety is a component, and let them know what works for you. You know, if you let them know that you too struggle in some of the same things, whether that's paying attention or getting up a lot, um, but you find something that works, make sure they understand that. You can also encourage, um, if you have your child seeing a behavioral health professional, you encourage them to communicate with the teacher, and so that they can also help to reinforce some of those concepts.
Okay, thank you. Someone writes, I work with autistic students in public school who have a very difficult time staying online for any length of time to participate in online school. What are some strategies that you can recommend?
I've been telling kids you have to take breaks, and that breaks can mean different things. So if somebody has to be online for 30 minutes, they may not be able to turn off or to walk away from the camera. They may, if you can build that in, if you have a class where people have similar needs, you can certainly do that. So what I'm teaching now is I'm teaching kids some physical strategies. So that might be standing up, posing their body. The kids get a kick out of posing like a superhero, taking some deep breaths, closing their eyes and counting to maybe 3 or to 5 very slowly in their mind, so it's not disruptive or stigmatizing, giving them some ways to kind of clear the mind. I always talk to kids about the difference between head filling activities and head clearing activities, and that when they do take breaks from a screen, make sure they're not taking a break with another screen. Make sure that they're doing something to clear their mind and to take advantage of whatever breaks that they have. And of course, working with the teachers around ways of doing that. I've had some students tell me that one of their teachers has everybody applaud at the beginning of class and at the end of class. And I think it's a wonderful strategy. I know it sounds so simplistic, but it gets that energy level up and it clears the mind so that they're ready to look at the screen for another 30 or 40 minutes. But it's a challenge. It is definitely a challenge. And so again, like everyone else, we're really looking forward to when this is over. But in the meantime, we have to employ whatever strategies we can.
Okay. Next, we have somebody that is asking about a teenager, how you can help a teenager with irrational fears at bedtime, such as being scared of kidnappers, robbers, etc.
Okay, so that could be, again, I'm not going to make a diagnosis for a specific child, but very often that kind of fear is indicative of separation anxiety in general. So, so sometimes kids that have those fears, they may, in general, kind of worry about their parents or caregivers. They may have difficulty separating at school, and so you want to give them ways to, certainly you can comfort them, but when you comfort somebody for anxiety, it's important to have I call it a warm but matter-of-fact approach. So you don't want to be dismissive of their anxiety and say, "Come on, just go to bed, just get over it. There's nobody here." But you also don't want to be overly indulgent, and it's natural to do that. Don't get me wrong, but you want to say, "Okay, what can you do about this? Let's think about this. How are we safe? The door is locked. We live in a safe neighborhood. Whatever you can give that child, just go over it briefly, kind of matter-of-factly. And if you do have a strategy that he or she can use, whether that's listening to music or a night light or a comfort object, say, okay, now we know it's safe. Here's your comfort object. Have a great sleep. And here's what you can do. And if they need to go into you, then what you do is you go back to the room, you comfort them there so they get used to comforting themselves in their own bed.
Okay. And going back to a question about working with autistic students, the previous question was about staying focused online, and we have someone that kind of picks up on that and is asking about what if autistic children have sensory issues related to the use of screens and they need to learn online. Are there any strategies that can relate to addressing their sensory issues?
Yeah. Um, there may be. Talk with your pediatrician now or with an optometrist or ophthalmologist, but there are certainly things that you can do with screen glare. I don't know about the validity of these things, but I've seen there's been I'm seeing glasses for kids that are tinted that can help with the glare aspect of it as well. So that might be useful. Encouraging them to look away from the screen during breaks if they can, or during breaks in the teaching material can certainly help. Um, and and again, it's just kind of doing what we can to get through this. But I would definitely look, because typically it, it's we all suffer from the glare, but with kids on the spectrum, it reaches another level, particularly if it's bright. So there may be things that they can do with their settings to perhaps dim it. Some of those things may help as well.
Okay, thank you. We have just one or two more questions. I think we can get them in. So someone is asking about if you have any thoughts on the use of antidepressants for social anxiety.
Yeah. So medication is sometimes needed for anxiety. I have some kids that I've worked with, and uh, they want to learn the therapeutic techniques, but they're so anxious. They can't even practice the techniques, not even in my office. So in that case, I would often seek a consultation from a psychiatrist, preferably. Um, and there's some pediatricians that are comfortable as well with prescribing. Um, SSRIs are in terms of anxiety disorders, SSRIs are the first line treatment. There are benzodiazepines, which are short acting anxiety meds, but the problem with those is that they're short acting and they're addictive. So they should not be prescribed long term. And again, I'm not a physician, so just bear that in mind. So certainly, if somebody needs medication for anxiety in general, including socially related anxiety, that is certainly something that can be considered. But again, obviously these things would be done in consultation. And if you do have if you see a psychiatrist, but you also have a neurologist in the mix and maybe another professional, please make sure they're communicating, okay?
Okay, and let's try one last question, I think. So we have someone that asks if all of the things that you are speaking about, which many of which are sort of talking about younger children, if these things would also pertain to a 23-year-old that has a history of TS and ADD and bad anxiety. So are the things that you mentioned for younger kids also things that could be helpful for someone who is 23 with those diagnoses?
Yeah, no, that's a great question, and I should have pointed that out earlier. Usually at the beginning of the talk, I mentioned that. My work throughout my career has kind of bounced between adults and kids, and but my last stint over the last 10 years, it's been with kids. So a lot of my examples are kid based, but a lot of what I said, all of what I said could also apply would also apply to adults as well. Just the content of my examples was geared for a child audience. But yeah, so if you're talking about an adult, so you're not talking so much about school, but you're talking about what the work setting is. So you want to make sure that people in the work setting understand some of these things and they're setting up that work environment so that it's optimal. Or if somebody's in a supportive living situation, you want to make sure that the residential staff are also aware of what some of these anxiety triggers are so that they can help to manage it.
Okay, great. We are at 8:30, so I think we'll stop there. There's perhaps one or two questions that we didn't get to, and if there are any, then we can address those on the blog. So I want to thank you again, Dr. Lynch, for a great presentation with some really practical takeaways and strategies. And I'd like to turn it over to Kelly now to conclude the evening.
You're welcome. My pleasure.
Thank you all for joining us on our webinar on neurodevelopmental conditions and anxiety, common causes and effective solutions. There is an exit survey which we need everyone attending to fill out. Our blog is open now and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, Using Positive Psychology to Find More Happiness Every Day, will be presented by Dr. Anton Shcherbakov and is scheduled for January 13th, 2021. Wow, that seems like so far away. This ends tonight's session. Thank you, Dr. Lynch, for your candid answers, and thank you, everyone, for attending. Good night.